Let's talk about scar massage. This is one of the best things that you can do for yourself to support an optimal recovery post-surgery. That could be a C-section, it could be any abdominal surgery, it could be perineal tearing from a vaginal delivery, or really any other kind of surgery. Scar massage is so helpful to avoid something that we call adhesions. An adhesion is any stuck area where one layer of tissue is healing in a sealed or stuck way to another layer of tissue, when those tissues normally should glide freely over each other. So that can result in something that, if it's on the surface layer, the skin sticking to the muscle, we see that visually as little puckerings, or some people call it a muffin top or a little C-section shelf. So they're little things that you can see on the surface of the scar where suddenly the skin texture is different and there's a little puff or some kind of a shelf. You can also feel the adhesion as a stuck area that doesn't want to move. So the drawbacks of scar adhesions are not just cosmetic, they actually are very functional. When there are deeper layers of scar adhesions in the muscle layer, the fascia, even all the way down into the organs, it can lead to real functional and health issues long term. Those include back pain, bladder frequency, pain during intercourse, and a host of other things that you might not even think would be connected to a surgery that happened years ago. But the good news is that we can prevent and even release scar adhesions from scars that are recent or even decades old. So I'm going to show you the most important techniques so that you at home can help your body heal and avoid scar adhesions and the symptoms that come with those. So when should you start scar massage? The soonest is after the incision has healed, which is typically 4 to 6 weeks post-op. And if you're a little bit unsure, you could always ask your medical provider if your scar incision has healed enough that you could start to do some massage. But you can actually release scar adhesions, like I mentioned, that are even decades old. That will take a little more perseverance and persistence with your daily massage, but you still can release those scar adhesions and see improvements in any symptoms that might be related to those. I recommend that you continue to do daily scar massage until all of the adhesions have released. And how do you know that? When there are no more stuck areas. So let me show you how you can identify an adhesion and also how you can release that with scar massage. So if we think about the 3 different layers of healing that your body is doing after a surgery, there's the skin to muscle layer, and then there's the deeper muscle and fascia layer, and then there's the deeper organ. So let's start with the skin. So when you're first approaching the scar, you might feel a little bit nervous. That's very natural. It's also been a trauma to the body that you might feel a lot of emotion around. So don't be too hard on yourself. If it's really difficult to touch the incision itself right away, you can work your way up to it. So start by approaching near the scar. So if we pretend this is a C-section adhesion, the seam in my pants, I want to take my hands and use some sort of gentle pressure. And I'm going to push the skin down and then up and then side and then side. Then I'm going to move my hands over a little bit. I'm going to push down, up, side, side. And I'm going to keep doing that along the scar, down, up. And I'm looking to find an area where it doesn't want to move, where it's kind of stuck. And once I find a little stuck area, I'm going to push kind of gentle pressure with a little bit more firmness into that stuck area and breathe and try to encourage that area to release. So then I'll keep going. Sometimes if it's a fresh scar, you might release it in one session, but usually it's going to take more than one session. So be patient. So again, I'm going to go down, up, side. Oh, I find an adhesion over here. So I'm going to hold and just kind of breathe into that until that area releases. Good. And this could be mildly uncomfortable as you release the scar adhesion, but it shouldn't be excruciatingly painful, okay? So now I'm doing another common scar massage technique, which is circles. So I'm just doing circles, and I'm right above the incision, and then I'm gonna reverse, do the circles in the other direction. And again, I'm feeling for any area where it's stuck, and if I find a stuck area, I'm gonna hold for like 30 seconds, a good 30 seconds, maybe even up to 60 seconds, trying to let that scar adhesion release. And you want to feel it kind of like give. So then I'll do the same thing below the scar. So I'll do a little down, up, side to side, all the way along the length of the scar. And I can do those circles. So I'm doing the little circles. And after you've done above and below the incision site, then you want to actually, this might be a little bit harder at first, so wait until you've been used to doing other aspects of the massage, but you then want to approach the actual incision site itself and kind of get it between your finger and thumb, and you want to kind of pull it away and really like release that skin layer from the muscle, because it's going to cause little acute pain, like sudden tugging, if you leave that stuck, and it also causes that sort of muffin top or puffiness. So you really want to get it all to glide freely. What I've noticed anecdotally is that often on the side of the scar where the surgeon has tied it off, it seems to be more likely to adhere there than along the rest of the scar. Sometimes it's just one side of the scar that is stuck, or just one little area. So, just keep an eye on it and notice the improvements too as you start to do this daily scar massage. So after you do that first skin layer, then you want to do the same thing, kind of thinking about going a little bit deeper. So you're going to go down, up, side to side. And this time your intention is more about feeling the fascia and the muscle layer. So that's a little bit deeper than the skin. And then to get the most important scar adhesions to release, which sometimes we even forget are possible, those deep scar adhesions where the tissue is healed in the organs, you need to get into a backline position so that you can really release that deeper tissue. So at home you can do this lying on your bed or on the floor, but it's really important that you lie on your back and bend your knees so that you can relax the muscles and get deeper into the organs. So you're going to use the same massage techniques that we used standing up for the skin layer and the muscle layer, but now you're going to really put your intention deeper into the tissue, into the organs. So I'm gonna approach above the scar and I'm gonna press in, trying to really sink my hands deeper. And I'm gonna push that tissue down, up, side to side. And then slide it over, down, up, side to side. And then I can do those circles. And I'm going to do this above and below the incision. And once you're comfortable touching the incision site, you can actually do it right on the incision itself. You just really want to think about finding those areas, and if there's any place where the tissue doesn't want to give, then you breathe and press into that site for about 30 seconds and try to let that tissue release. Good. So I recommend devoting about 5 minutes a day to that self-massage until you feel no more adhesions. So there are no more stuck areas on any of the layers of tissue. And then once you have released all of those adhesions, I recommend checking in about once a month for up to 2 years post-operation, because the body is still producing scar tissue for 9 months and maybe even up to 2 years after the surgery. So you just kind of want to check in. I would put it on your calendar, so maybe the first of every month, you do a little scar self-massage just to ensure that your body hasn't started to form new adhesions. One extra tip that I learned recently from a pelvic health PT is that when you're performing your self-massage, you really don't want to use any oils or moisturizers, because those products can make your hands slippery and you'll actually be less effective at releasing the adhesion. So if you want to moisturize, that's also a great thing. Just keep it separate from your scar massage. So you might do your 5 minutes of self-massage first thing in the morning, take a hot shower, and apply moisturizer after the shower. Just one suggestion. I also do recommend, for starting this habit of daily scar massage, that you find one time that works for you and do it at the same time every day. Maybe right before bed, first thing in the morning, but devote those few minutes to your self-care and it will really boost your recovery.